Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Annosvatas, and in that regards, we have discussed Malavrod in last two lectures. At the end of the last lecture, I have asked you one question that you have four patients of Malavrod in front of you, and you have four dravya which are good for the Malapravritti. For example, you have Aragvad, you have Haritaki, you have Snohi, you have Jayapal. Which drug to which patient you will choose? In simple language, in the Karma Vichar, we know that regarding Malapravritti, there are Anuloman, Stramsan, Bhedan, and Virechan Karma described in the text. So you have these four dravya having performing these functions, each one of them. One is Trausan like Arava, one is like Haritaki, which is Anuloman, one you have got Snuhi or Katuka for Vedan Karma, and Snuhi, Arkakshir or Jayapal for Virechan. Now you have four patients of Malavrat in front of you, and you have got these four drugs with you. How you will decide which drug is useful to the which patients? So let us discuss this topic today. Now, if you think of these functions, you will find that Anuloman, Stramsan, Bhedan and Virechan are Uttarottar, have high intensity. In Anuloman, there is it just Pakam, Kurtva, Pakam, Maranamcha, that Malabag is there, just make digestion of that and throw it out. Stramsan, Shlishtam Koshthe Maladikam. I will not go in details, you know that shlok of Stramsan. That means Malabhag is not only in the intestine, but it has now stuck to the intestines. What it indicates? It indicates the higher intensity of Malavra. Third is Bhedanam. What it happens? Pindidam Malay. The Malabhag now gets Pinda Swarup. It means like stone like structure or like that. And so what it indicates again, it's again high intensity of Malavra. And fourth is Virechan. It means whatever format of Malabhag, it is Slishtam, Pakva, Apakva, Pindit, whatever it is liquefied and thrown out of the body. It is Virechan. So these karma performing same function regarding Malapravritti, that it is going to throw out the Malabhag out of the body, but the intensity of this karma increases. That means history of Malavrod is much more higher level at every step. So when you are going to choose these dravya, what factors you have to keep in mind? Firstly, the history of constipation. If it is a 1 day or 2 day, Anuloman will be there enough. If it is more than 4 days, 5 days, 7 days, and patient is not getting Malapravritti, he has to strain it out, then go for the Stramsan. In old people, it's a common complaint said by the patient in the old people that there is a stone like Malapravritti, and I have to figure it out sometimes. So it again indicates higher indication of Malavrod, and it will require the medicine with the more weary or more strong medicine. In that case, Bhedan is expected, and Virechan is a very higher purgative or which will throw it all it out. So again, either it will be a very chronic constipation, or it is indication of some disease like Udaritu Virechanam, Tamikatu Virechanam, like that, where Virechan of that level or Malapravritti of that Malavega of that intensity are expected. So when you are choosing a drug for Malapravritti in Malavrod patients, first indication should be the intensity of the symptom, where how much days the patient is suffering from. First thing. Secondly, Coaster of the patient. If the patient has history of 1 or 2 days, but if he says I have the intensity tendency of this constitution life long or right from my childhood and I have to strain it out, then if their cruel coaster is there, in spite of having small duration of the Malavrot symptom, you have to choose the higher purgative because coaster is not going to defecate easily. Third, age of the patient. In old age, the Malavrot is a very common and irritating symptom for the patient. So many a times Anuloman or Stramsan are not enough because of the age factor, dryness in the intestines, Vata Prako. So in that case, in spite of having small duration of Malavrot, you have to keep in mind the higher intensity like Bhedan or even Virecha. Third thing which is very important to is the age. Like I said, in gestana, in senior citizens, dryness is more. But if the patient is Bala, patient is Garbhini, and patient is of Alpasatva or already dehydrated by any Atisara or any other reason, then always remember that in that case, in spite of having high intensity of Malavrot or the history of Malavrot is more, still in Bala, in Garbhini, and even in very sick patient, you have to do with the Anuloman or Stramsan. So this factor also should be taken into consideration as far as when you are going to choose the dravya for the patient. Now, in all these cases, of these 4 types of cases, always remember, as I said, Hetu Parivarjan is the main thing which has to be counseled to the patient, and otherwise it will give only a symptomatic relief. Patient which comes to you always says that give just for 1 or 2 days, I will not make habit of that. But always remember, it is very difficult to be away from this habit because patient always thinks, okay, just take today, let me clear the abdomen, and next day I will not go for that. But it doesn't happens. It is very prone to the patients to get addiction of these drugs, and for to reduce this addiction, you have to counsel the patient about the Hetu Parivarjan and changes in the lifestyle. So, Anuloman, Stramsan, Bhedan and Virechan, these 4 types are mentioned in the text due to the intensity of the constipation, cost of the patient, and choosing these you have to keep in mind Bala, Garbhini, Avastha or a special Avastha of the patient. So, it looks easy that Malavrot, I gave some tablet, I gave some churna. It is not so. If you have to rule out this complaint permanently, all these factors come in the frame of the treatment. Now, as I said in the last lecture, that rule out the cause is the very important thing, and the dryness of the intestine is generally the major cause. If you give some churna or which are present in the market, patient takes also the on the counter, you will find some drugs are already ruksha in guna, for example Nishottar, and they just do this action by their virya and they throw it out. You will find many drugs which are commonly used in the kalpa or in the markets are ruksha guna, they throw it out, the malapravritti, malabhag, sanchita malabhag, but they do not cure the dryness of the intestine, which is the root cause of the Malavrot mainly. What to do about this thing and how to get it out, the dryness of the intestines, we will discuss in the next lecture. Thank you very much.